Personality disorders. Causes. Personality is the combination of thoughts, emotions, and behaviors that makes you unique. It's the way you view, understand, and relate to the outside world, as well as how you see yourself. Personality forms during childhood, shaped through an interaction of your genes. Certain personality traits may be passed on to you by your parents through inherited genes. These traits are sometimes called your temperament or your environment. This involves the surroundings you grew up in, events that occurred, and relationships with family members and others. Personality disorders are thought to be caused by a combination of these genetic and environmental influences. Your genes may make you vulnerable to developing a personality disorder, and a life situation may trigger the actual development. Risk factors. Although the precise cause of personality disorders is not known, certain factors seem to increase the risk of developing or triggering personality disorders, including family history of personality disorders or other mental illness, abusive, unstable, or chaotic family life during childhood, being diagnosed with childhood conduct disorder, variations in brain chemistry and structure. Complications. Personality disorders can significantly disrupt the lives of both the affected person and those who care about that person. Personality disorders may cause problems with relationships, work, or school, and can lead to social isolation or drug or alcohol abuse. Diagnosis. If your doctor suspects you have a personality disorder, a diagnosis may be determined by physical exam. The doctor may do a physical exam and ask in-depth questions about your health. In some cases, your symptoms may be linked to an underlying physical health problem. Your evaluation may include lab tests and a screening test for alcohol and drugs. Psychiatric evaluation. This includes a discussion about your thoughts, feelings, and behavior, and may include a questionnaire to help pinpoint a diagnosis. With your permission, information from family members or others may be helpful. Diagnostic criteria in the DSM-5. Your doctor may compare your symptoms to the criteria in the Diagnostic and Statistical Manual of Mental Disorders, published by the American Psychiatric Association. Diagnostic criteria. Each personality disorder has its own set of diagnostic criteria. However, according to the DSM-5, generally the diagnosis of a personality disorder includes long-term marked deviation from cultural expectations that leads to significant distress or impairment in at least two of these areas. 1, the way you perceive and interpret yourself, other people, and events. 2, the appropriateness of your emotional responses. 3, how well you function when dealing with other people and in relationships. 4, whether you can control your impulses. Sometimes it can be difficult to determine the type of personality disorder, as some personality disorders share similar symptoms and more than one type may be present. Other disorders such as depression, anxiety, or substance abuse may further complicate the diagnosis, but it's worth the time and effort to get an accurate diagnosis so that you get appropriate treatment. Treatment. The treatment that's best for you depends on your particular personality disorder, its severity, and your life situation. Often, a team approach is needed to make sure all of your psychiatric, medical, and social needs are met. Because personality disorders are long-standing, treatment may require months or years. Your treatment team may include your primary doctor or other primary care providers, as well as a psychiatrist, psychologist or other therapist, psychiatric nurse, pharmacist, or social worker. If you have mild symptoms that are well controlled, you may need treatment only from your primary doctor, a psychiatrist, or a therapist. If possible, find a mental health professional with experience in treating personality disorders. Psychotherapy, also called talk therapy, is the main way to treat personality disorders. Psychotherapy. During psychotherapy with a mental health professional, you can learn about your condition and talk about your moods, feelings, thoughts, and behaviors. You can learn to cope with stress and manage your disorder. Psychotherapy may be provided in individual sessions, group therapy, or sessions that include family or even friends. There are several types of psychotherapy. Your mental health professional can determine which one is best for you. You may also receive social skills training. During this training, you can use the insight and knowledge you gain to learn healthy ways to manage your symptoms and reduce behaviors that interfere with your functioning and relationships. Family therapy provides support and education to families dealing with a family member who has a personality disorder. Medications. There are no medications specifically approved by the FDA to treat personality disorders. However, several types of psychiatric medications may help with various personality disorder symptoms. Antidepressants. Antidepressants may be useful if you have a depressed mood, anger, impulsivity, irritability, or hopelessness, which may be associated with personality disorders. Mood stabilizers. As their name suggests, mood stabilizers can help even out mood swings or reduce irritability, impulsivity, and aggression. Antipsychotic medications, also called neuroleptics, these may be helpful if your symptoms include losing touch with reality, psychosis, or in some cases if you have anxiety or anger problems. Anti-anxiety medications. These may help if you have anxiety, agitation, or insomnia, but in some cases they can increase impulsive behavior, so they're avoided in certain types of personality disorders. Hospital and residential treatment programs. In some cases, a personality disorder may be so severe that you need to be admitted to a hospital for psychiatric care. This is generally recommended only when you can't care for yourself properly or when you're in immediate danger of harming yourself or someone else. After you become stable in the hospital, your doctor may recommend a day hospital program, residential program, or outpatient treatment.